James, let's go ahead and get started with your exam.
All right.
Looks like you're in for just a basic HEENT today. Decided to have you laying down for this exam. You were complaining of a little bit of back pain, kind of unrelated to your appointment today. So is this a comfortable position for you?
Yes, it is.
Okay, perfect. So I'm just gonna go ahead and get started with kind of a brief overall inspection of your face. Are you experiencing any issues related to your head, eyes, ears, nose, or throat?
No, I'm not.
I'm just gonna have a look over your face, like I said, looking for any kind of abnormalities, either in the skin or around your neck area. Look for any swelling. Overall skin appears to be healthy. Look at your eyelids and eyelashes. Come with the eyebrows. We're just gonna have a look at your scalp and your hairline. Any issues with your scalp? No itchiness or dandruff or anything? Okay, so hair appears to be normal. I'm not seeing any issues with your scalp. Hair follicles look healthy. Hair shaft appears to be intact. There's not any signs of breakage. Skin texture is normal. Maybe some very slight dryness in this area. Can you just have you turn your head either side for me and have a look at your ears? Ears are a little cold, but skin texture is normal. I'm not seeing any sign of discoloration, and doesn't appear to be any excess sebum that's kind of seeped into your outer ear canal, which is good. Just have a look at the back of your ear. Okay, texture and color is normal. Very good. Okay. Now have you turn your head the other way for me. Again, texture is normal. Not seeing any issues with discoloration or any kind of visible abnormalities. Back of the ear looks normal. While your head is like this, I'm gonna have a look at your chest. Just move your shirt a little here. All of that looks normal. Go ahead and turn your head to a neutral position for me. I'm going to have just a basic listen to your temporal arteries here. Checking for even blood flow. So let me go ahead and the inside of your shirt. Perfect, okay. All of that sounds normal. So why don't we go ahead and move into some palpations here. I'm just going to test for any pain or abnormalities in your jaw. Okay, so I'm going to do a little bit of tapping like this, and I want you to just tell me if any of that causes you any discomfort. Issues with that, and this time you can just kind of hang out. I'm just gonna listen for any abnormal sounds as I kind of oscillate here. Sometimes if there are more hollow sounds, it can tell me that there might be some abnormalities. So far, everything looks and feels normal. Can you hang your jaw open for me? A little more. Very good. Okay. And no pain or discomfort with any of that, correct? No. Perfect. Okay. So what I'm going to do next as far as testing your head is I want you to turn your face either side. We're going to be testing both sides, so you can start whichever way you prefer. I'm going to be pushing against your face. I want you to push against me in the opposite direction and try not to let me control your head, okay? So go ahead and start. Good. Other side. And down. And back. And open your jaw. Don't let me close it. Close it. Don't let me open it. So I want you to tightly close your eyes. Don't let me open. And then I want you to open. Try not to let me close. Good. Okay. Doesn't appear to be any issues with that. I am just going to place my hands under your head, and I'm going to manipulate your head. I want you to just allow me to do so, okay? Can you tilt your head back for me? Good. Any pain or discomfort with that? No. Okay, you can return your head to a position that's comfortable for you. So the next thing I want to do is test your sensation in your face. So I have a couple different things here. Can you tell that this is soft? Yes. So I want you to say yes when you feel it in various areas on your face, okay? Okay. Eyes closed. Perfect. And can you tell that this is sharp? Yes, I can. It's the same thing. I want you to say yes when you feel it. It'll either be like this or like this. Either way, say yes. Okay. Yes. 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 Okay. So this time I'm going to alternate between sharp or soft. And I want you to say either sharp or soft, okay? Yes. Sharp, soft, sharp, soft, sharp, soft, 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 sharp, soft, soft, sharp, 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 soft, Good.
Soft. Sharp. 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 Soft. Sharp.
Okay, good. So this time I want you to tell me if this feels equal bilaterally. So you're going to tell me if it feels equal on both sides, okay?
Yes. 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 One side.
Good job. And one last one. Does this feel equal all the way down?
Yes.
Perfect. Okay. So sensation appears to be within normal limits. I do want to just test one last thing. I have a little wheel here and it's pretty sharp. It looks more alarming than it actually is. I'm just going to be moving this on various parts of your face, mainly in one direction. I want you to tell me if the sensation changes as we move along, okay?
Okay.
So feel the same all the way down.
Yes, it does. A little sharper there.
Sharper towards your eye.
Yes.
Okay, that's totally normal. Same there.
Same. 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 Same.
Here.
Yes.
Here and here is the same.
Yes.
Same, same,
Same.
same. Feel normal here, no pain or discomfort in your hair.
No.
And on the jawline, feel the same on both sides.
Yes.
And how about here, here?
Yes.
How about here and here?
Yes.
Same here.
Same.
Perfect, okay. So definitely not suspecting you're having any issues with your sensation, okay? So if I can have you lift your head for me, I'm gonna do just a quick measurement of the size of your head. 26.5 inches there. And 24 there. 9, just about 9 inches from chin to forehead. And 13 there. Okay. So all of those measurements are within normal limits for someone of your age and height, which is good. So I'm not suspecting anything really wrong with the health of your face and head overall. Let's go ahead and move on to a bit of an eye test. This is going to be a little different because you are laying down, but trying to accommodate that back pain there. So I want you to just open your eyes for me. I'm going to have a look inside your pupils. I'm just going to be moving your eyelid a little bit. Looking for symmetrical reaction. Can I have you look up towards me? That's bright, I apologize. Perfect, okay, so that appears to be normal. Okay, so I want you to just remain looking up at me. I'm just gonna shine this at the bottom. Perfect, so I'm gonna place my finger here and I want you to look at that. Try not to look at the light. And I want you to keep your head still and follow my finger. Any floaters or double vision with any of that?
No.
Okay. So then I want you to keep your Alright, line of sight remaining straight. Look at the ceiling. I'm going to move my fingers on either sides of your face. I want you to tell me what number you see me holding up. So this would be 2, 3. We'll kind of go from there, okay?
All right. 2, 2, 3, 1, 4, 2, 2, 5, 1, 2, 3, 4.
Very good, okay. So no double vision or anything with that. Did either of the hands appear blurry or discolored?
No.
Okay, perfect. So I'm not suspecting any abnormalities with your eye health. I do know that you wear glasses, but
Yes.
your prescription is up to date, correct?
Yes.
Perfect, okay. So let's go ahead and move on to testing your nose, and basically I just want to see that you're not having any kind of occlusions on either side. I'm going to test the overall patency of your nares, so I'm going to be occluding one side,
Okay.
and I want you to just breathe in normally for me. Okay?
Sure.
Go ahead and breathe in. In here. Any abnormalities with that? Are you feeling kind of a closure on one side? Both sides appear normal to me.
Yes.
Okay. So I'm going to do both sides. I want you to take a breath in through your mouth. Out through your nose. Very good. Okay. Doesn't appear to be any abnormalities with that. Nose is pretty midline. I'm not seeing any signs of a deviated septum or anything there, so. Okay. Let's go ahead and move on to your ears. And first, I just want to see if there's any kind of discolored cerumen or earwax in your ears. So I have some regular just cotton buds here. I'm going to be very, very gently inserting this into your ear. Okay, nothing there. And nothing there. Perfect. Okay. So I'm going to do a very brief test of your hearing. The first thing I'm going to do is make a sound on either side. I want you to just first tell me what side you hear it on, okay?
Sure.
So close your eyes for me.
Right side. Left side. Right side. Left side. Left side. Left side. Right side. Both sides. Left side. Right side. Right side. Right side. Left side. Left side. Right side. Both sides. Both sides. Left side. Right side. Both sides.
Very good, no issues with that. So the next thing I'm going to do is occlude one side and whisper something on the opposite side. I want you to just repeat after me. It'll be a series of either 3 numbers or 3 words, okay?
Okay.
Apple, orange, lemon,
Apple, orange, lemon,
purple, yellow, green,
purple, yellow, green,
peaches, oranges, apples.
peaches, oranges, apples.
Good job. We're going to do the other side. Doctor, nurse, patient,
Doctor, nurse, patient,
student, teacher, principal,
student, teacher, principal,
chicken, pork, steak.
chicken, pork, steak.
Good job. This time I'm going to do a series of numbers and they're going to be a little bit quieter, okay?
Okay.
21, 32, 57,
21, 32, 57,
18, 23, 54.
18, 23, 54,
There we go. Color sign. 18, 32, 53,
18, 32, 53,
17, 5, 6.
17, 5, 6.
Very good. good, James. No issues with that. The last thing I'm going to do to test your hearing is to make a very slight sound with my tuning fork. So just to start, I want you to tell me if you can hear it. So can you hear that?
Yes.
Perfect. So just say yes if you can hear it, okay?
Yes. 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 Yes.
Good. And now I'm going to be putting it against your ear. You're going to hear it stop, and then I want you to tell me when you hear it again, okay? You hear that?
Yes.
Tell me when it stops.
Okay, stop. I hear it again.
Good. Do that again. You hear it?
Yes.
Tell me when it stops.
Stop. I hear it.
Very good. Okay. This time I want you to tell me when you stop hearing it. So I'm going to move it further away from your ear. Tell me when you no longer hear it. Can you hear it?
Yes.
Tell me when it stops.
Right now.
Very good. Here.
Yes.
Tell me when it stops.
Stops.
Good job. Okay. No issues with your hearing. That appears to be totally normal. Alright, James, so the last thing I want to do for your HEENT today is just check your throat. So I want you to just open and close for me. Good, okay. I'm just going to feel around your trachea, also feeling your thyroid. Is there any discomfort here?
No.
You don't ever have any issues with your swallowing, correct?
No, I don't.
Can I have you swallow for me? One more time. Perfect. Okay, so that appears to be totally normal, and I would say that you passed with flying colors today, James. I'm not seeing any abnormalities in your head or with your eyesight. Your prescription is up to date. Like you said, you're seeing your optometrist regularly. Should you see any differences or abnormalities with your vision, I recommend going back to your optometrist.
Okay.
Your hearing was totally normal. Not seeing any reason why we would need to test that further. And your nose seemed healthy. So overall, I would say you're pretty good to go. Clean bill of health from me today. If you'd like, we can schedule your yearly visit up at the receptionist desk. I would like to see you back in a year. That's just kind of standard. We prefer to do annual visits just to keep up with everything that's going on, make sure we're not missing anything. So you can either schedule that now or call in when you're ready, okay?
All right, thank you.
All right, James, thank you so much. Have a good day, and I hope your back gets better.
Thank you so much.